October 10 every year is celebrated as World Mental Health Day, and this year the focus was on suicide and how to prevent it. Now, mental health has seen some form of neglect over the years, and I have with me here one of the PR members of the Accra Psychiatric Hospital to tell us about what they are currently facing. The news has been that they are struggling to actually fund some of these patients that are in the Accra Psychiatric Hospital. Today, as you can see behind me, they are having a screening to give back to society and also to commemorate the World Mental Health Day. Emmanuel, thank you so much for joining us on the Citi Newsroom. Let's come to how you are dealing with these challenges coupled with all other challenges that you are facing as a psychiatric hospital.
Basically, it has been the issue of hand to mouth. When we receive something small, we try and then manage it for the rest of the year. Subsidies are not coming. Yes, I know that for some time now, government has tried for us to clear our debts, which I'm sure that by now we should have cleared our debts. But you see, we need the money to be able to run the facility. As it stands now, for Accra Psychiatric Hospital, the only internal generated funds we have is from the lab, and then from our 24-hour pharmacy, and then something small from the electroconvulsive therapy department. Aside these things, we have no IGS running, and then because of that, we had to take something small for the services that we run. So our folder 20 cities, consultation 10 cities. How much will these monies altogether even help? Look at the number of vagrant cases we have. Look at the number of admissions we have. Look at the number of people who turn in. I was speaking to Dr. Kwesio this morning, and then statistically we realized that about 1,600 people were vagrants on the streets. So if all these people were pushed to the hospital, and mind you, most of the referral cases come to our end because when you go to Pantine, they take the charge there. When you go to Ankafo, so if people are coming to Accra Psychiatric Hospital in these cases, we mean that what are we going to do to help them? Okay. So it's not been an easy journey. We are doing our best as a hospital with the backing of the managerial staff, the PR team, the administrator, the director. We are doing what we can do best. That is how come you see these things happening.
Okay. All right. So tell me about the health screening that you have organized today, and why did you decide to give back to society, considering the fact that you are constrained when it comes to finances?
Well, as management, we sat down and we said that, hey, yes, we are going through a lot of challenges. Hey, we are going through a lot of things. But see, we often are blessed because we get philanthropists, we get people doing us good. Why not also with our expertise also give back to the society? So you realize that part of our screening, we are doing a psychological screening, stress screening, sugar, malaria, glucose levels, BMI, and the rest for the society. We want the people to understand that, see, just like you go to the hospital, you have a running stomach, or you have diarrhea, you have a problem with your leg, your head, any part of your body. In the same way that your brain also malfunctions sometimes, and then its results may be very devastating. So why not? Can't we do a sort of a first aid? We screen people for people to understand that, hey, your brain, your mind can also be screened to find out your stress level, whether or not you are in good shape or not. So that is why we gave back to the society.